Hey everybody, it's Ron, and I want to tell you a story about business and how that story changed everything. The break room is quieter than it should be. Now, hospitals are never quiet, but this room in a hospital in Lombardy, Italy, has gone still for a moment. Two nurses sit at the small table near the coffee machine. Their masks are hanging loosely around their necks after another long shift. Neither one of them has finished the coffee in front of them. The television in the corner is tuned to an international news channel. The volume's low, but the room's quiet enough that the words can still carry. On the screen, the man stands in front of a blue backdrop covered with the emblem of the World Health Organization. Cameras are flashing, reporters lean forward in their chairs. One of the nurses glances up at the screen. "What are they saying?" she asks in Italian. The older nurse squints at the subtitle and listens carefully. The speaker's talking in English, and she catches pieces of it, though not every word. He's describing the spread of the virus, how the number of cases outside China has grown quickly, how the number of countries affected keeps rising. The other nurse shifts uneasily. They already know this part. They've been living it for weeks. Then the man at the podium pauses. The older nurse leans closer to the television, and he says the word slowly. Pandemic. The nurse at the table repeats it under her breath, testing the sound of it in Italian. Within hours, that word will ripple across the planet. Governments will close borders. Airlines will ground flights. Offices will be empty. Markets will swing wildly as businesses try to understand what comes next. But sitting in that quiet hospital break room, another question hangs in the air. Who exactly decides when the whole world is facing the same threat? Who coordinates what happens next? And where did that system actually begin on April 7th, 1948? From Business Basics, I'm Ron Trucks, and this is Business History, a daily podcast where we explain stories that changed business forever. Every date on the calendar has a story where business reshaped the world. Today, April 7th, that story takes us to 1948, when the world built a global health system. Long before anyone was watching press briefings in Geneva or hospital televisions in Lombardy, governments had already learned a difficult lesson. Diseases travel the same routes as commerce. In the early 1800s, outbreaks of cholera swept across Europe again and again. The illness moved along the same networks that carried goods and passengers, spreading through busy ports, crowded cities, and trading routes that connected one country to the next. And that created a problem for governments. One country might try to impose quarantine rules for arriving ships, while another refused because those same rules would slow trade and anger merchants. Every nation understood the danger of disease, but no one wanted to be the first to disrupt commerce. So in 1851, representatives from 12 countries gathered in Paris for something new, the first International Sanitary Conference. Their goal wasn't to cure disease, it was to coordinate responses to it. They debated quarantine rules, shipping inspections, and how nations should report outbreaks without triggering economic panic. The negotiations were slow and often frustrating, but the idea behind them would prove important. If trade had become international, that meant disease had also. The world needed systems that crossed borders. But even those early systems were small and fragile. Organizations like the Office International de Hygiene Publique in Paris, and later the League of Nations Health Organization, could collect information and issue warnings, but they had limited power. Then, in 1918, the world learned just how dangerous that limitation could be. The influenza pandemic that year, often called the Spanish flu, spread faster than governments could track it. Troop movements during the final months of World War I accelerated its reach. cities filled with soldiers returning home. Ships carried the virus from continent to continent. By the time the pandemic burned out, it had killed tens of millions of people worldwide, making it one of the deadliest disease outbreaks in recorded history. And it exposed something painfully clear. The world's health systems were national, but the disease, it was global.
My Alzheimer's diagnosis was hard to take.
But early detection allowed us to take control of the situation together.
Talk to your family about seeing a doctor. Go to alz.org/time to talk. A message from the Alzheimer's Association and the Ad Council.
When World War II ended in 1945, governments began building a new international framework designed to stabilize the world. The United Nations was created that year, followed by a series of organizations meant to manage different parts of the global system. There were institutions focused on finance, or agriculture, or labor, and reconstruction of Europe. Health quickly joined that list. Delegates gathering for an international health conference in New York in 1946 began drafting the Constitution for a new organization that would coordinate global health policy. The goal wasn't to replace national health systems. Instead, it would connect them. The new institution would track disease outbreaks, coordinate international responses, and serve as a central clearinghouse for medical research and public health data. When epidemics appeared, countries would have a system for sharing information quickly and coordinating action. The memory of the 1918 influenza pandemic still loomed over those discussions. Governments understood what could happen when disease spread faster than information, but they also understood something else. The modern world was becoming even more connected. Air travel was expanding, shipping routes were busier than ever. Commerce was becoming global again after the war. And if people and goods could move quickly across borders, so could the next epidemic. So the delegates drafted the Constitution for what would become the World Health Organization. But international agreements don't activate overnight. Countries had to ratify the document before the organization could officially begin operating. That threshold was finally reached on April 7, 1948, when the Constitution took effect and the World Health Organization formally came into existence. For the first time, the world had a permanent institution designed to watch for the next global health threat.
Wouldn't it be great if life came with a remote control? You know, you could hit pause when you needed to, or hit rewind, like that time you knocked down that wasp's nest. Uh-oh. Or that time you forgot to roll up your windows in the car wash.
Fantastic.
Yeah, a remote control would have come in handy then. Well, life doesn't always give you time to change the outcome, but prediabetes does. With early diagnosis and a few healthy changes like managing your weight, getting active, stopping smoking, and eating healthier, you can stop prediabetes before it leads to type 2 diabetes. It's easy to learn your risk. Take the 1-minute test today at doihaveprediabetes.org. Life doesn't come with a remote control. Yikes! So you're on your own with the wasps. You have the power to take control of prediabetes. Visit doihaveprediabetes.org today. That's doihaveprediabetes.org. Brought to you by the Ad Council and its Prediabetes Awareness Partners.
And here's Heather with the weather.
Well, it's beautiful out there, sunny and 75, almost a little chilly in the shade. Now, let's get a read on the inside of your car. It is hot. You've only been parked a short time and it's already 99 degrees in there. Let's not leave children in the back seat while running errands. It only takes a few minutes for their body temperatures to rise, and that could be fatal.
Cars get hot, fast, and can be deadly. Never leave a child in a car. A message from NHTSA and the Ad Council.
When the World Health Organization officially came into existence on April 7, 1948, it did not immediately look like the institution we recognize today. At first, the organization was small. Its early work focused on the kinds of threats that had haunted previous generations: malaria, tuberculosis, smallpox, cholera. The job of the organization was to gather information, coordinate research, and help governments share strategies that could slow the spread of disease. But over time, the organization's role expanded along with the world itself. As air travel accelerated in the second half of the 20th century, outbreaks could move across continents in hours instead of weeks. Trade networks connected factories, farms, and cities in ways earlier generations could hardly imagine. And that meant health crises could now ripple directly into supply chains or into labor markets and into entire national economies. One of the organization's earliest and most visible successes came in the campaign against smallpox. By coordinating vaccination efforts across dozens of countries, the organization helped eliminate the disease entirely by 1980, marking the first time humanity had intentionally eradicated a major infectious disease. But the World Health Organization's influence extended beyond vaccination campaigns. It became the hub for global disease surveillance, monitoring outbreaks and sharing information with national governments. It helped develop international health regulations, guided responses to emerging diseases like SARS and Ebola and H1N1, and served as the central platform where countries could compare data, coordinate their responses, and sometimes argue over what should happen next. Because that's the complicated reality of global institutions. They don't command the world, they connect it. And that connection matters. When the declaration of a pandemic appears on television screens in hospital rooms or government offices or trading floors, it carries weight precisely because it comes from a system built decades earlier to watch for threats that cross borders. A system that began when the World Health Organization's existence was ratified on April 7, 1948. I'm Ron Trucks, and this is Business History, the podcast that finds the turning points behind the headlines. To hear more stories like this, follow us on Apple Podcasts, Spotify, YouTube, or wherever you listen. And if you're enjoying the stories, do me a favor. Don't forget to subscribe and leave a quick review. It helps more people discover the history behind the business decisions that shape our world. And do you want to actually understand business better? Start by visiting us at businessdailypodcast.com.